everybody. So my name is Mr. Thomas Sewell, and I'm a gynecologist based in the southwest of the UK. And it's a great pleasure for me to talk at this ICS online conference. And I'm talking about some research we have performed alongside my colleagues, Mr. Sharif Tawfeek and Mr. Reda Afifi. And we have performed a research study into the risk of ureteric injury during ipsilateral uterosacral ligament bolt suspension with intra-operative cystoscopy. And I hope you enjoy it. As some background to the topic, as many of you will be aware, post-hysterectomy vaginal bolt prolapse is common, occurring in up to 40% of women post-hysterectomy. In addition, this can significantly affect a woman's quality of life by causing pelvic or vaginal discomfort, as well as negatively affecting bowel, bladder, and sexual function. Therefore, many would advocate the use of a procedure performed alongside hysterectomy, and this can be performed alongside any form of hysterectomy, including laparoscopic, abdominal, or vaginal hysterectomy, such as a uterosacral ligament bolt suspension to prevent future prolapse. However, there is a valid concern by many that this may increase the risk of ureteric injury. Therefore, we set out to investigate the risk of ureteric injury during uterosacral ligament bolt suspension procedures. And we did this by employing a reliable technique to identify ureteric injuries, namely the use of intra-operative cystoscopy with indigocarmine dye, which was used in all cases. So in terms of the methods, we used a retrospective observational study design, and we performed uterosacral ligament bolt suspension following hysterectomy in all cases. The primary outcome measure was the incidence of ureteric injury or obstruction. Overall, we analysed 127 consecutive cases, and the most common indication for surgery was prolapse. The overall complication rate was 7.1%, and in terms of ureteric injury, which was our primary outcome measure, this occurred only in a single case, giving a complication rate of 0.8%. This actually occurred during the hysterectomy part of the procedure prior to the uterosacral ligament bolt suspension. This injury was identified by cystoscopy with indigocarmine blue dye and allowed prompt repair during the procedure and a minimal morbidity to the patient. In conclusion, this retrospective study would support the view that uterosacral ligament bolt suspension performed alongside hysterectomy is a safe and feasible procedure to perform. And we would certainly recommend such a procedure performed alongside hysterectomy for nearly all indications as a way of preventing future post-hysterectomy vaginal bolt prolapse.